the plenary session. And for the sake of time, I would briefly maybe request the PMTCT manager NASCOP, Neri, to take us through the introduction on PMTCT, where we are in terms of progress of PMTCT in this country, so that we can be able to get a brief of where we are. So, Dr. Neri, karibu sana.
Good evening. I have to adjust this mic because I'm not the same height. Yeah, so my name is Nelly Pato Dindi. I'm the PMTCT program manager currently at NASCOP. I'm very passionate about children. More so since I got into the public health space. I've really been enjoying the work that we are doing. Just reaching not one child at a time as I did when I was in the clinicals, but reaching many at the same time and being able to make an impact. So mine is to just give an introduction to the ending AIDS in children by 2030. So I'll just be looking at the elimination of mother-to-child transmission, that is EMTCT, and I'll also talk about the pediatric care and treatment, just to give us a general picture of where we are at, where we have come from, what the status is. So I have an outline, a brief one. Oh, thank you. Yes. So I'll do a short introduction, then we look at CAL HIV. So CAL HIV is children and adolescents living with the HIV. We just look at where we are at currently in terms of our status, our data, and how our children are doing. Then we look at the sources of infection or new infections for the children. And then we look at elimination of mother-to-child transmission. What does it entail? What is it? What do we do? And also look at a little bit of some performances or our performance as a country and also the counties in terms of the mother-to-child transmission rates. Then we'll also look at the progress in ending AIDS in children in Kenya. Now, where are we? What have we been doing? What strategies do we have in place? And what have we set in place to move forward? Okay. Sorry, technology. Not moving. Okay. So this is just a brief on the statistics according to the estimates of 2023. So overall, we have an HIV prevalence of 4% with a prevalence of 5.3 in the females and 2.6 in the female and in the male, sorry. And a total number of 1.377 million people of all ages living with HIV. When we look at the adults, we have 309,915 approximately of those that are over 15 years. And then for the children of 0 to 14, we have approximately 67,869. And then those that are getting new infections or have gotten new infections in this year, all ages, 22,154. Amongst them, 17,860 are adults, and we have 4,474 children. And then for young adolescents and young people, we have 88,853 living with HIV, and those that got new infections, 3,244. And then for those that are between the ages of 15 and to 24, those are the young adults, we have a total of 145,142. And new infections amongst this population group is 7,307. Sorry. So Kenya has made very significant progress in terms of controlling the HIV epidemic. And when we look at the UNAIDS standards, where we talk about the 95, 95, 95 cascade, we are seeing that the adults are doing very well, or the general population is doing very well. I don't know if this is the pointer. Okay, yeah, but so we can see that when we look at all population for the 95, 95, 95 cascade, where the first 95 is 95 of all people living with HIV being diagnosed or being identified, and then 95 of all of that category being on treatment, and 95 of those that are on treatment being virally suppressed. So for the general population, you can see the performance there. 94, is it 94, 95, my side from here, then 94 and 89. Then when you look at the adult population, we have 95, 95, 90. But when you look at the children, we are at 85, identifying them, and then 85 of those that have been identified are the ones that are on treatment or ART, and out of the ones that are on treatment, only 74% are virally suppressed. So you can see that the gaps are quite glaring with this data that we have, and clearly the children are being left behind, and this calls on us to do something concerning the children. So if we go deeper into the cascade, we see that this is how the numbers look like, or what the 85% represents. So the 9, you can see, and those that are currently on ART are also 85. Virally suppressed are 74, just to give more clarity from the 95 cascade that I've shared before. Okay. Yes, so this diagram just represents the number of or percentages of children that are being covered or are on treatment, especially 0 to 14 years. And then we are comparing to the adult population, that is the 15, going onwards. And we are seeing the trend from the year 2010 all the way to 2022. And we can see how the blue line that represents the adults has been steadily, going up in terms of coverage. And then for the children, we had a steep increase at some point, and then we are on some form of plateau right from the year of 2017. So it means even for treatment coverage, we are not doing very well for the children. And for optimization of care, we now have the DTG regimen, that is the recommended regimen for all children. So when we moved the children to the DTG regimen, we are seeing here that we still have a gap, or we still have a number of children that we have not been able to reach for us to be able to optimize. So that means even those that are on care, not all of them have been optimized. We are at 86% performance currently. And then this is the coverage in the country in terms of our counties. So you can see the areas where we are having lower coverage of DTG of less than 20%, the northeastern side mostly. And then as we move towards the right side of the map, it's getting brighter, meaning that the percentages are increasing. And then where we have even lighter colors, we are seeing Siaya, Homa Bay, around that area where we have more than 90% DTG coverage. So we can see that the treatment is affecting children. So we have 6 children dying every day due to HIV AIDS-related reasons. And the causes of death, actually, when we look at them, these are preventable. Pneumonia is a vaccine-preventable disease. Malaria is also preventable. We have several means of preventing it. Malnutrition is also preventable, and sepsis, also calling them infections, are also preventable. So we see that maybe one of the reasons to us why we are getting this, or we are seeing this data, is because once a child has acquired HIV, if we don't give them the proper care and treatment that they require, then the statistics are actually shocking that 30% or a third of these children actually live to age 1. And 50%, if they don't get any care and treatment, get to age 2, and only 80% get to age 5. So you can see how our children are really being affected. And apart from mortality, we also have those that are HIV positive and are not getting the proper care and treatment, regressing in terms of their progression in milestones. So now let's look at the new infections in children. I think at this point it's also important to remind ourselves, for those of us who already know and those of us who are new, what are the modes and risk factors for transmission from mother to child. So we have 3 areas that a child can be infected vertically. So we have during pregnancy. We see, especially if the risk factors are high viral load, viral load in the mother, intrauterine infections, malnutrition, and anemia. A child can also be, or an infant can, fetus can be infected during labor and delivery. And risk factors include high viral load, placenta separation, rupture of membranes of more than 4 hours, invasive procedures, vacuum extractions, and chorioamnitis. And the other way that an infant can be infected is that during breastfeeding, especially if the mother has got a high viral load, there is mixed feeding that is happening. The mom has got breast abscesses, nipple fissures, oral lesions, and in the baby, so that now there's a way that the virus can get through. Again, when we categorize the new infections that are happening, if we look at the adolescents and the young people, just to give us more data on where the new infections are actually happening, you can see the different age groups. Between 0 and 9, we have 15%. Between 10 to 24 years, we have 35% of this age group getting new infections. And then 25 to 34 years, we have 29%, 35 to 44, 14, and over 45 years, 7%. And then when we categorize them further into male and females, we can see that we have more females being infected in these age groups. So, and these females are actually females of that are within the reproductive age. So we have a higher risk of this group actually getting new infections, and if they don't get the proper care and treatment, then transmitting to their infants. This gives us more details on when exactly or how or the infections or the new infections happen. So we are seeing the highest number being mothers who did not receive antiretroviral therapy during pregnancy or breastfeeding. So if a mother is HIV positive and they don't receive their ART, from the data that we had from 2020, 1,558 of these were transmitted to their infants. And then mothers who stopped antiretroviral treatment during pregnancy or breastfeeding, 1,431. And then mothers that acquired the HIV during pregnancy, so they were diagnosed newly during pregnancy. And then we also have mothers on antiretroviral treatment but did not achieve viral suppression. So if a mother does not achieve viral suppression, then transmission occurs. This just to give us more insight on the different percentages of how the transmissions or where the transmissions are occurring. And a summary is that 67%, the absolute number is given there, of new HIV infections in children, that is 0 to 14, were attributed to either pregnant and breastfeeding women not receiving ART, that's 35%, or having their treatment interrupted, that's 32%. So from this, we are seeing that it is very important that an HIV positive mom gets treatment and they continue to be on treatment. Adherence and retention as one of the main pillars of prevention of mother-to-child transmission. This one here also shows us new infections as well. So we see 12 children being get infected every day in the nation, and we have a trend that the map is giving us a trend from the year 2010 to 2012, and we can see the relationship between pregnant women ART coverage and the number of new HIV infections in children. So just generally, the higher the coverage amongst pregnant women, the lower the new infections occurring. So we can see the relationship between ART coverage amongst pregnant women and also the new infections. So now we're going to look at elimination of mother to child. So we've already seen from our discussion so far that it is very important for us to have timely initiation and support for HIV treatment for pregnant and breastfeeding women that are living with HIV for us to reduce mother-to-child transmission. And this is the cornerstone really of having children that are going to be HIV-free. But also timely testing and treatment of children who are HIV infected is very critical to avoid or to prevent them from deteriorating into AIDS and dying. So for prevention of mother-to-child transmission, when we are not just talking about HIV, we are now speaking of triple elimination, where we are eliminating HIV, syphilis, and hepatitis B. So it means that we need to offer comprehensive care in antenatal care for us to be able to achieve mother to child or to prevent mother to child transmission. So it means then we are saying that all women, unless they are already known HIV positive, should receive counseling and testing of HIV, syphilis, and hepatitis B during their first ANC. But also it is important for us to repeat the test, and we are using dual tests to be performed in the third trimester if we found them to be negative in the first test. So we have 4 prongs in PMTCT. So this is what are the 4 main things that entail prevention of mother to child. So the first one is primary prevention. So we were saying those that are HIV negative should remain HIV negative. So we are preventing them from getting new infections among the women of childbearing age. That is prong 1. Prong 2 focuses on preventing unintended pregnancies among women living with HIV. So here we focus mainly on contraception and family planning. And prong 3, we are preventing percent